gentlemen, welcome to our grand finale, our final session here on day 2 at the Abu Dhabi Global Healthcare Week. We've had a fantastic day 2 here on M42's main stage, and this final session promises to really deliver. We've got a very exciting subject area, balancing the microbiome for better health. I'm going to welcome on stage a friend of the M42 stage. I had a chance to share a stage with him at Arab Health. So please do give a big round of applause to our moderator for this session, Dr. Pranab Gawali, who's a consultant gastroenterologist, Mubadala Health, Dubai. Dr. Pranab, thank you very much for joining us. And we have an illustrious panelists who are going to be joining you. I'll ask you to just pick up your mic, and then maybe between us we can ensure that we invite our guests on. So Farah Helou, who is M42's Wellbeing Counselor and Precision Nutritionist. Thank you so much, Farah, for joining us. Dr. Sara El Wali, who's a staff physician and gastroenterology at CCAD. Dr. Mohammed Alam, who's a staff physician and also at the gastroenterology of the Cleveland Clinic, Abu Dhabi. Very well represented here. Thank you so much, and the stage is yours. Thank you.
Thank you very much. Thank you very much. And let's all sit down. Welcome, everyone. Welcome those here and those who are joining us online. What we're going to try and do is uncover a little bit about the gut microbiome. So we're going to start with, as it's a topic that not many people are familiar with, let's first have a little understanding about what the gut microbiome is. I'm going to start off with asking that. What is the gut microbiome? I'm going to direct that to you, Sarah.
Hi, thank you very much, and thank you for staying. I know it's late, it's been a long day, so we really appreciate you being there. So the gut microbiome is something that's really fascinating, and we've really been learning a lot more about it the last few years. What it is essentially, it's your gut flora. It's all these microorganisms that are, resting in our gut, and most of them are bacteria, and there are billions and billions and billions of them. There are more than 1,000 species of them, and essentially, what we found out over the recent years is that we've been able to actually identify them, because initially, you couldn't really culture them. The usual way of really identifying bacteria is by culturing them. But so with the DNA sequencing technology that has gotten really good over the years, we're able to actually say which species do exist in our gut. And it's actually quite interesting because it's opened a whole new world to us. We've noticed that, depending on changes that you may have in your microbiome, this may lead to some diseases like Parkinson's disease, inflammatory bowel disease, and so it's really quite fascinating.
So that's really interesting. So Sarah, what you're saying is the gut microbiome consists of all the bacteria and the viruses and all the metabolites that they produce within the gut. Now, is there any way of testing it that's currently available? Can I ask Farah?
Thank you very much, Dr. Pranab. Yes, absolutely. So with the advanced sequencing technologies that have been developed, it's really revolutionized the way we look at the microbiome. And we utilize the most advanced technology, which is shotgun metagenomic sequencing. And this has really helped us better understand the different species that are inhabiting an individual's gut, in addition to identifying the various species and strains, because different species can have different functions. So we're all familiar, let's say, with bifidobacteria or lactobacilli, but there are so many different types, and they act in different ways, and a lot of them act synergistically. But in addition to identifying what's in the gut, we're able to identify how do they act, and it's these functionalities, what is their role? What is the role of each of these species? Do they have a pro-inflammatory impact and anti-inflammatory impact through the metabolites that they produce? And those metabolites have been linked to various diseases, such as cardiovascular disease, cancer, even obesity. So by understanding what is in there, what role do they play, are we able to better understand how we can utilize these tests in a clinical setting to make them clinically valid and for clinical utilization.
That's very interesting. So you have a way of testing this, and you mentioned this word quite complicated, and I think a lot of people won't understand it, but can you explain a little bit more about shotgun metagenomic sequencing? In simple words, why is it so good, and what differentiates it from other tests? Why is it that particular one? And
yeah, so again, it's way more advanced than, let's say, 16S RNA, PCR. So we're looking at the microbiome as a whole. We're looking at the different types of bacteria, but also archaea, potentially parasites, viruses. So it's looking at the microbiome as a whole, yeast as well. And in addition, we're looking at the metabolites. So it's the metabolites that have been linked to health. So either a positive or a negative impact on health. So with other technologies, it's very hard for us to understand, how are these microbes, what are they doing, and how are they impacting health? So it's really the metabolites that we need to understand, again, whether they're positive or negative, or pro-inflammatory or anti-inflammatory, and shotgun metagenomic sequencing can really help us identify these metabolites.
that's really fascinating, and it's good to hear that that is the best technology, because I think most of the audience will know that within the GCC region, the only company that's able to provide shotgun metagenomic sequencing happens to be M42. So it's quite helpful to have that ability to do this sort of very specific testing available here. Now, moving on to the idea that I think now understand that the microbiome consists of all these bacteria and viruses within your system, and there's ways of testing it. I'd like to understand a little bit more of how can you make an impact on the gut microbiome. Can I ask Dr. Mohammed to talk a little bit about that?
So how do you change the microbiome?
Yes,
I guess that's
yes.
the question. So the different ways of it, some are crude ways or non-prescription ways, if I can say that, and some are medical ways. So the standard things which we use is obviously food is the first thing, obviously. Your lifestyle can also affect that, your smoking habits and different lifestyle stuff. That's one methodology. The second is obviously, which is very frequently used, is the use of probiotics. Although they can always question the science behind it, but that's one methodology. The third, which is medically used, is the FMT, which is the fecal microbiota transplantation, and I hope we'll talk about that a little bit later, where we basically get the poo from one person and implant in a person with a medical condition. So this is what we call an additive way. So you're adding, so FMT is a way of adding microbiota, whatever the body requires, into a patient's or an individual gut. The second way of editing which is a relatively newer, is sort of what is called LBP. I believe that's the correct word. Okay, and then this is also a bacteria, but not actually vaccine. And these are not coming from a human, so obviously a lot of quality control issues are easier, and you can manufacture them by cloning, and again use them in implanting good bacteria in the bowel. This is the area which is maximum interest is lying, and most of the research is happening as probably the most promising area. So you have crude ways, which I have described. You have addition ways. You can actually put bacteria in the ways. And another method will be what we call subtractive ways. So you can actually get rid of the bad bacteria, and where you can use what we call bacteriophage viruses, for example, the virus which eats the bacteria. So you can design the virus and then you say, I want this particular bacteria to disappear from my colon. And that's another very interesting technology, probably a little bit early in the phase of development. So these are the three methods you can actually use to sort of modulate the gut microbiota.
That's fascinating. So I think what you're heading towards is the future where you're actually giving precision, either pharmacy medicines, or actually using FMT to modify somebody's microbiome profile to fit what therapy you might wish to achieve. That's interesting. But coming back to now, can I ask Farah a little bit more about the easy ways of modifying your gut microbiome? What's the top 3 things you would say?
Yes, absolutely. And diet's really the most effective way that we can modulate the microbiome. And we're all, the first 3 years of life are really critical because we form kind of like our microbiome print that stays with us down the line. But through our diet, we are able to modulate and, support the growth of beneficial bacteria. So, we always stay focused on the 3 Ps, which are the prebiotics, the probiotics, and the polyphenols. And, it's things that we most likely eat on a daily basis. So prebiotics are fiber-rich foods because ultimately what feeds and nourishes our microbiome is fiber, right? Whether it's whole fruits, vegetables, legumes, whole grains. So any type of cultural food that contains the fiber. Unfortunately, a lot of our food is processed nowadays and has had a lot of nutrients in the fiber stripped out, let's say. So fiber or prebiotic-rich foods.
Yep.
Probiotic-rich foods, which are foods rich in these beneficial bacteria. A lot of these foods are fermented, let's say. And then polyphenols. Polyphenols are what we find, again, in leafy greens, vegetables, whole fruit. So they have strong antioxidant properties, but ultimately, they also nourish the growth of beneficial bacteria. So prebiotics, probiotics, and polyphenols. And what we should ideally stay away from is a high intake of food, things like red meat, saturated fats, which have been found to cause more of a dysbiotic or an imbalance in the gut microbiome. Of course, high sugar foods, but I would say, even foods that are high in sugar sweeteners, things like aspartame, which have been found to impact the microbiome in a negative way as well.
Okay, so you say the top 3 things are the dietary components.
Yeah.
Well, a lot of people talk about how the brain can affect the gut as well. Is there anything you would like to say about stress or exercise, for instance? Do they have an impact on the gut?
Yes, absolutely. And, they can impact the gut in a negative way, but, exercise, whether it's too little or even too much, can have a negative impact on the gut. Stress through the gut-brain axis, there's constant communication between the gut and the brain through, various signals that go up and down, basically. And so, promoting more of a relaxed state, mind-body medicine is really important because the gut is also producing quite a bit of neurotransmitters, serotonin, GABA. So supporting a healthy microbiome can help improve mental health and vice versa. There has been quite a bit of research to show that in individuals with either depression, anxiety, schizophrenia, they do have an imbalance in their gut microbiome. And so modulating that could potentially be promising in terms of interventions.
Fascinating. Okay, so let's move on to an area which is actually very, very, very much close to what Sarah, you do at CCAD, inflammatory bowel disease, affecting the bowel. Let's connect that up to how do you relate the gut microbiome with IBD, and where are we seeing things developing in that area?
It's such a great question. Thank you, Pranab. So maybe we'll just take you back a little bit to what IBD is. So IBD is inflammatory bowel disease. It's actually an autoimmune disease that causes inflammation of the gut. And these patients can get a lot of bad symptoms like diarrhea, weight loss, rectal bleeding, abdominal pain. And it's essentially immune mediated. So it's the immune system that attacks the bowels, and that leads to inflammation. And so why is it that we love to talk about microbiome in inflammatory bowel disease? It's actually quite fascinating. To be honest, Pranab, we don't know the full story. We're just discovering the importance of microbiome, but we think it actually may be involved in causing potentially Crohn's disease or ulcerative colitis. We still don't know the cause of these diseases, but what we found out recently is, for example, the microbiome is very different in patients with inflammatory bowel disease. It's less, it's less diverse. So this dysbiosis either leads or is associated with, let's say, disruption in the barriers that are supposed to protect our gut. And what happens after that, those bacteria, viruses are lying around, and then you get this cascade of inflammation, and then you get the full-on disease. A very interesting example that I wanted to potentially bring up, there have been studies where they took microbiome from actual patients with inflammatory bowel disease. And they took that stool essentially and transported it or transferred it to mice that were healthy. And they got inflammatory bowel disease and they got worsening inflammation. So we know there's something there and it's fascinating, but we need to learn more about it. But you know, Pranab, there's also, so for example, what we know in inflammatory bowel disease is that the worst inflammation usually is at the spots where there is essentially stagnation or stasis of the stool. So for example, in Crohn's disease, it could be in the small bowel and the terminal ileum. So we know that these bacteria are doing something, and we still need to find out a lot about it.
That's very fascinating, and that reminds me of a study I came across fairly recently called Gut 108, where they found mice which had deficiencies on certain 17 bacteria that were deficient in these mice with colitis, and they replaced it with a certain laced probiotic and replaced all 17 bacteria and reversed colitis in this mouse model. And they're working very hard on a similar model in humans. It hasn't been proven yet, but there's certainly something about that which works in the mouse model where the environment can be very well protected and controlled, but doesn't yet get to that in the humans. But I think that's the future where we're heading, and I think that's really interesting experiment that you highlighted. Now, moving on to another area, I know Dr. Mohammed, you're interested in. For instance, colorectal cancers and fatty liver disease, these are the GI conditions. Can you highlight how the gut microbiome might be connected?
So I think like any other modern epidemic of diseases, like inflammatory bowel disease or non-alcoholic fatty disease, and I'll come to colon cancer in a minute because that's a very area of much interest recently, especially in younger population. It looks like the growth in obesity, the growth in inflammatory bowel disease, and the growth of colon cancer in young patients, they're all following the same trajectory. So something is happening, and this is all coming from, obviously, epidemiological studies. They're not classical causative relationship, but the pattern is visible that something common is driving all these factors. And if you look at ourselves, what has changed literally is what we are eating, or whether we are traveling too much, or we are living in a more industrialized society, and they all point to gut microbiota, obviously. I'll come to the fatty liver disease, and it's actually very important because it's an epidemic, as we all know, around a third of population is suffering from that. Obesity is rampant. What's more interesting is there is very good quality data showing that nearly 30% of patients with IBD will have fatty liver disease as well. Of up to 40% of patients actually will be obese in IBD patients. So we are seeing more and more obese patients. You will think, like, my gut is inflamed. I should be losing weight. But that's not what's happening, unfortunately. So this is a very good indirect evidence that the microbiota is driving everything. If you look at the pathophysiological point of view, it all comes down to the mucosal barrier being broken. Liver is the first port. Whatever gets absorbed goes to the liver first and then goes to the rest of the body. So it appears that liver takes most of the brunt. When you have a toxic drug, you take antibiotics, liver takes the first brunt, and it appears that the first brunt, when you break the mucosal barrier, goes to the liver as well, and hence obviously more risk of developing fatty liver disease. So that's the question. I'll come briefly into colon cancer as well. It's a very complex topic, very poorly understood like IBD, but I do want to emphasize that the risk of colon cancer in the patients population less than 45 has nearly doubled. So if you go back 20 years ago, 10% of the patients will be less than 45 years ago. Fast forward 2024, if you look at all the epidemiological data, that number has gone up to nearly 20%. So that's all is directing that something is happening in the way we are living, which is changing the gut microbiota, driving all these medical conditions.
Thank you, Dr. Mohammed. I think we're coming close to the end of this program, but I would like to just end by asking my colleagues to point out that the top tip regarding gut microbiome, where they see things heading in the future. I'll start with you, Farah.
Thank you, Dr. Pranab. I think the the whole field of the gut microbiome is extremely fascinating, and the data and the research continues to grow. And as my colleagues mentioned, the gut has been linked to every single part of the body: the gut-brain axis, the gut muscle, gut joint. It impacts our hormones. It's very diverse. From a dietary and nutritional standpoint, it's really a very personalized approach. We all know what we should be having and what we should be consuming to promote a healthy microbiome, but ultimately, sometimes individuals can't tolerate some of these foods. So it's really important to personalize recommendations. And when we have data such as gut microbiome testing, we are able to personalize our recommendations to make them more practical, realistic for the client, and to ensure that we are able to promote a healthy gut ecosystem utilizing at least personalized nutrition.
Thank you. The last minute, Sarah.
A quick word on something that I find really fascinating. So we were saying that we're finding out a lot about microbiome and these bacteria and these viruses, but I think what we're also going to find out in the next few years is that they secrete metabolites, they secrete proteins, and that opens a whole other world to discover. So how are these related to disease? How do we even make sense of it? So I think a lot of research is going to focus on that, and we have a lot to discover the next 2 years.
Thank you very much. I'm not sure we've got time for questions, but maybe if there's anyone having a burning question, we'll have one. Go for it.
Thank you. Kwan, is it working? Yes, it is.
Thank you. First, I'd like to thank you. You have on the stage the best specialist in the area. And I have 3 questions. Number 1 for Farah. So what do you recommend in terms of probiotics? Since Dr. Alam said probiotics and he laughed, should we not recommend probiotics?
It has to be a very personalized approach, because the way we look at medications, different medications for different purposes, it's the same with probiotics. We're all about precision probiotics. And when we know, how each one acts, some of them are, provided for individuals struggling with IBD or, different conditions. So yes, but ultimately we have to undergo a thorough assessment with a client, because I've seen so many individuals not tolerate probiotics. So it's important to have that personalized approach, as opposed to, grabbing them off the counter and then.
Yeah, so just for me as a dietitian, when they ask me what probiotic should I take, should I refer them to you, doctor?
Well, first and foremost, encourage probiotic-rich foods. Looking at diet first.
Yeah. Second question: everyone is on GLP-1 receptor agonist, like all these weight loss medicine. I'm sure they affect the gut because they slow down the digestion. Any studies with regards to these?
So what we know is these medications definitely have a lot of effects on the gastrointestinal tract. And what we know is they probably slow down the digestion, and that's probably also why they work so well. We've seen it in our patients that their stomach can be full of food hours and hours after a meal when it's supposed to be empty. So I think again, this is a very new area for us. And for example, since we specialize in inflammatory bowel disease, what we're noticing is that it may even be beneficial in those patients, by making them lose weight. They may respond better to medications. So yes and no. Yes, it may have some negative impacts on the gastrointestinal tract, but at the same time, it does lead to a lot of benefits. So a lot to come.
Last question,
Final
promise.
Yes.
Yeah. I receive lots of patients coming from outside the CCAD referrals, and they are all diagnosed with SIBO, like healthy patients diagnosed with SIBO. So what's the story about it? Are we all having like intestinal bacterial overgrowth, or is it just a new fashion?
So I'll take it. I'm not an expert. I don't claim to be an expert in that, but I think it is definitely overcalled. It's a very loosely used term, unfortunately. There has to be evidence of bacterial overgrowth proven objectively in a patient with high risk, like diabetic or elderly patients who had previous gastrointestinal surgery. These are the patients who should be tested for it and then labeled as SIBO, rather than every bloater is not a SIBO. Yeah, that's correct.
Thank you, everyone. There's somebody who wants. Okay, one final question. Yes.
Thank you so much for this really very informative session. I have 2 questions, and it's majorly about FMT. read a story about, again, a patient who was dying in the ICU, and then with the FMT that came from the mother, they were able to save the life of that patient. So my question to you is, again, having important genetic components, with these, again, coming from the same family of, microbiomes. So the question, can that be used, again, a relative, a mother or a father who is healthy, to treat patients with inflammatory bowel disease? So this is one question. The second question I have for you is, again, my generation and so many of this generation that came after me, we were all treated with antibiotics since we were children, and there was all this talk about the first years of life and how antibiotics affected our microbiomes. So the question is, there are any research to actually use microbiomes of populations that were not affected like us in Western world, that we've been using antibiotics, to really bring back our old-fashioned microbiomes? Thank you.
I can
Sarah,
take the first question quick.
Very quick.
So thank you for bringing up the FMT. So there is one indication only that we have been really allowed to use it, at least, for example, let's say in the US and Europe, which is C. difficile infection. It's a bacterial infection that leads to diarrhea. And actually, by doing FMT, you get more than 90% cure rate. And usually we use it for recurrent infection, the recurrent C. difficile or severe C. difficile that's not responding to treatment. The cure rates are fantastic. They're phenomenal. We have not been able to reproduce this in IBD. Unfortunately, there have been studies that looked at it. Not that it's not working. There are some data that it may be working specifically in ulcerative colitis, but not yet enough to really allow us to do this on a regular basis. So it's still being looked at. But one indication that where it's allowed is C. difficile, and it works very well.
Thank you. And I think we'll end on that count. I'm sure there's lots of questions. Please find anyone of my colleagues here afterwards, and we can have more of a conversation. Thank you all.
And thank you so much, Dr. Pranav, for expertly moderating that particular panel. We're going to get a wonderful panel photograph before you end, so please do stand up and our photographer will oblige. Thank you to the team. Thank you to the photographer and the technical team who've been very diligent in capturing all these moments. And thank you to our audience. You stuck with us to the end of day 2. And I love the fact that we have so much enthusiasm, that there's questions right to the end. Thank you so much. Big round of applause to you all, and see you here tomorrow, day 3 from 10 o'clock. Thank you very much.